An ancient proverb says, "He who has health has hope, and he who has hope has everything." Working with people to help them maintain or regain good health gives you a chance to inspire that hope. By choosing to work in healthcare, you have made a commitment to a career that allows you to truly make a difference in the lives of the people you serve. DVD number 1, Focusing on the Patient. A career in healthcare can bring you great satisfaction. At the same time, it brings responsibility and the obligation to focus on the needs of patients in order to advance their well-being. The purpose of this program is to prompt you to recognize your importance as a healthcare worker and to develop attitudes that will contribute to your effectiveness. The ideas presented are designed to help you achieve 4 learning objectives. Know your worth and importance as a healthcare worker. Be aware of the need to respect others as individuals of value. Understand empathy and its importance when working with patients. Learn to show respect and feel empathy for patients. Even if you are planning a career that doesn't involve direct patient care, your actions still affect people in important ways. If you conduct lab tests, for example, working carefully to obtain accurate results is critical so that patients can be properly diagnosed and treated. If you work in the billing office, submitting the correct information to patients' insurance companies can help make the payment process hassle-free. Incorrect coding and billing can even result in patients having to pay more out of their own pockets. Remember that the names on the forms you complete represent real people who you may not know personally, but who are depending on you to make it possible for them to afford what it takes to be healthy. The bottom line is that everyone who works in healthcare plays an important part in the delivery of quality care to the people who use the system. Regardless of your job title, you truly make a difference in the lives of others. Throughout the program, we will look at situations based upon real healthcare experiences. Afterward, we will examine what happened from the different perspectives of the characters involved. Finally, you will have a chance to discuss the characters' decisions and analyze whether or not you think they successfully applied professional attitudes and behaviors. Due to the nature of illness and disease, you will probably encounter more elderly patients in your practice than you will patients your age or younger. Interacting with the elderly is a great opportunity to demonstrate respect and compassion for others whose experience of the world may enrich your day.
Hey there, Mr. Jones. My name's Cleo. I'm your physical therapy assistant. How you doing today?
I'm all right.
Okay. Well, today we're going to be using a walker. You ever used one of those before?
No. I really don't think my legs are strong enough. What if I fall and break a hip? Even trying to stand is difficult for me.
Well, I understand your hesitance, Mr. Jones. But you know, you gotta start somewhere. By the way, was that your son that brought you in today?
No, that was my grandson.
Your grandson? I never would have guessed.
Yes, he's good to me. He just finished graduate school. He's a computer scientist or something now. We both collect classic cars.
Really?
Yeah. We go to owners' meet and car shows. Well, we used to, before my stroke.
Well, you know, Mr. Jones, there is no reason why you can't go to car shows with your grandson again, or do any of the other things that you used to do. Just think of how nice it'll be to get around on your own again. Well, it's going to take a lot of hard work, but I think we can get you strong enough to do this. Okay. What I need you to do is put one hand here and one hand here. Alright, you're gonna do this so that you can pull yourself up with your arms, not your back. I want you to look straight forward, okay? Alright, don't worry, you're not gonna fall. I gotcha. I gotcha. There you go. There you go. You got it, you're standing. You wanna just stay here for a minute? How do you feel?
Pretty good, actually. I'm surprised.
All right, great. You're doing a great job. All right, now we're gonna take a step. This is what I need you to do. Just gonna move the walker forward a couple of inches with your arms and then step right into it, okay? All right.
I've always dreaded becoming a burden on my family. My wife and I have always been very active. We took a fishing trip to Alaska the year before she died. Since I had a stroke 8 months ago, everything's changed. I rely more on my grandson. Cleo has helped me find the inner strength to use the walker and to perform the strengthening exercises. She's a good therapist. She won't let you just give up.
Working with Mr. Jones has really taught me not to take life for granted. I'm really interested in my clients, and I learned something new from all of them. I've learned that I can make more of a difference if I know it's important to them. And it was really touching to see how much he loves his grandson. Sometimes, the progress that clients make in rehabilitation can go very slow, so it's important to focus on each small victory.
What kinds of personal things did Cleo discover about Mr. Jones? How might this help her sessions with him? How else might this contribute to the overall situation and to Mr. Jones's recovery? A fundamental concept in healthcare work is that every human being is entitled to respect and deserves your best efforts. Regardless of people's different cultures, ethnic backgrounds, levels of education, economic statuses, appearances, and current health conditions, every patient is an individual of worth who should be treated with respect. Most of us can work effectively with people who are pleasant. It takes special insight and caring, the characteristics you should develop as a healthcare worker, to work with more challenging patients. It is essential that you commit to serving all who need your assistance. In the next scenario, Carlos exemplifies one particular kind of patient who, despite his condition, deserves the equal attention and care of all others.
Hey, Steve.
Hey, Dave.
Hi, Carlos. I'm David, your nurse for today. It's Tuesday, December 15th. Christmas is really getting close. I'm just going to check your feeding tube to see how you're doing.
Dave? He can't really hear you.
We can't know that for sure. Research shows that some comatose patients retain their hearing.
Yeah, but doesn't it feel a little weird just talking out loud when no one's answering you? This guy's pretty far gone. Seems kind of hopeless.
Well, he still deserves our respect. Every patient is an individual. See? He's a hockey player.
Has something happening?
No, Senora Lopez. He's fine. Output is good. There's no infection. He's resting peacefully.
Oh, thanks God for small miracles.
We were just admiring Carlos's photo. My nephew's a hockey player also.
Oh, did you see the card his teammate sent?
No.
No? It's very nice. Let me show you.
Ah, it is very nice. It's a lot of signatures.
Yeah.
What position does he play?
Center. Thank you.
I realize that Carlos is comatose, but relating to people is an important part of my work. It just wouldn't be right for me to treat him like he wasn't there. If it was my kid, I'd want his caregivers to treat him with respect. I feel it's also my job to care for his mom. She's suffering and she can communicate.
I guess I never really thought about it before, you know? I mean, the kid's a vegetable. I guess I do feel sorry for him and his family, but I never thought to talk to the kid. I'd feel too embarrassed.
Carlos is a wonderful son. What else can I say? I want the best care for him. Everyone at my church is praying for a miracle. David, he's a good nurse, you know, because he talks to my Carlos. If Carlos ever wake up, I know he will like David.
How was David's behavior more respectful than Steve's? What are some of the positive effects of David's respect for Carlos? Was it appropriate for Dave and Steve to have their conversation in front of Carlos? We all interpret what we see through our own lens. Our view is shaped by the experiences that make up who we are. Most of us take our view of the world for granted. It often doesn't occur to us that there are very different ways of seeing the same thing. Empathy means trying to see the world through the lens of another. The first step in developing empathy is to recognize your own preconceptions. What beliefs and influences affect how you see the world? The second step is to accept that there are other views. The third step is to make an effort to learn the views of others by listening and observing what they say and do. Empathy does not mean feeling sorry for someone. It does mean trying to understand how that person might be feeling and why. It is important for you to know that even small healthcare events can affect a person. As a healthcare worker, you are likely to become quite comfortable in the healthcare environment. For example, those of you whose work involves regular use of high-tech equipment may find this to be one of the most interesting parts of your work. But the patient may have a different perspective. The equipment you operate every day may be the cause of nervousness and anxiety for some patients. Fear of discomfort, pain, and the unknown can be unsettling. Sometimes, patients may be afraid and may express their fear as frustration or anger. As a healthcare worker, you must be empathetic to this fact and not take it personally. The following scene demonstrates what can happen when we make assumptions about others instead of making an effort to find out about them.
Is everything
Keisha,
okay?
where have you been? I pushed this button ages ago.
Yes, I heard the
Keisha,
buzz.
this food is an insult. It is cold and tasteless. I have a terrible headache. Can you take this away and bring me something to help me rest?
Okay.
And I need another pillow.
Okay, Mrs. Mansfield, let me get this out of your way.
Every time I try to relax, someone is in here poking me and prodding me. This test, that test. How am I supposed to do well in surgery tomorrow if I'm exhausted and starved?
I'm very sorry you feel that way.
And Keisha, don't forget my pillow.
Keisha, are you okay? You look upset. It just drains me to listen to her. I know she's rich, but she doesn't own this hospital. I work hard, and it really gets to me to have to listen to complaints from people who can afford just about anything. I mean, this isn't a resort.
You are such a good friend to come see me. How's your family?
Fine, fine. It's you I'm worried about. How are you feeling?
Oh, I'm doing well.
Tell me the truth, Lily.
I'm terrified. Who knows what they're going to find tomorrow when they do the surgery?
I know you're scared. You're thinking about your brother, aren't you?
Well, of course. I mean, he went so quickly once it was diagnosed. And he was younger than me.
You have to think positive
Oh,
thoughts.
I can't. I'm terrified of hospitals. I am so ashamed of the way I have treated everyone here. They must think I'm terrible, but I just can't help myself. I can't stand the waiting. If I die, Who's going to take care of my husband?
I am a single mom, and I work hard to raise my 2 children. I bet that lady never has to lift a finger for herself. I enjoy nursing, but that woman shows absolutely no appreciation for what I do. She's as rich as you know what, and I can tell just by the way she looks at me that she thinks I'm incompetent.
Lily's a wonderful person. So many times she's opened her beautiful home for fundraising events for charity. She herself has worked tirelessly for the rights of poverty-stricken families in this country. Her husband has severe Alzheimer's, and she won't let anyone else take care of him. Last year, she lost her younger brother to cancer. I can see she's very afraid.
My husband has been getting increasingly ill over the past 2 years. He has no one in the world to take care of him except me. I've lived a good life. I'm not afraid to die. But my husband needs me. I can't leave him alone.
In what ways was Keisha unempathetic? What could she have done to show more empathy? How might this have changed the previous interaction? Every patient deserves your respect and empathy. How can you develop these values within yourself? Remember that the focus of your work should be the healthcare needs of the patient and not concerns about being appreciated. Here are 2 simple rules to get started. Ask questions to clarify understanding. Listen attentively without judging what you hear. It doesn't take a lot to demonstrate respect and empathy. In fact, it is often the many small actions of your day that confirm the worth of your patients and coworkers. In the next scene, a healthcare worker is empathetic to a patient and follows through with her actions in an attempt to secure the best possible care for him.
Okay, Philip. Now, before you can qualify for our study, I'm going to take your vitals, and then the doctor will come in and speak with you.
Good.
Okay.
Do you know how much the pay is?
No, I'm not sure.
Hello, Philip. I'm Dr. Osher.
Please.
I have to leave the office, so I thought I'd get this squared away.
Certainly.
What can I do for you today?
I came to sign up for this study.
All right. Let's see if we can work this out. Sit back, please.
Oh, yeah. Okay.
Just breathe normally. Have you ever been diagnosed with a heart condition?
No. Why?
How about any shortness of breath during physical activity?
No.
How about your sleeping habits? Are you sleeping well at night?
Yeah, absolutely.
Philip, I detect a slight murmur. Now, there's no signal of any symptoms of a heart condition. In fact, it may be just an innocent murmur, but it is something that should be checked out. I'm afraid this is going to disqualify you from our study. I'm sorry.
Ow.
Well, like I said, it just may be something simple, may not be serious at all, but I do recommend you see your doctor and have him do a full evaluation just to be sure. Thank you for your time.
Yeah.
I'm sorry we can't help you.
Sorry about that, Philip.
Yeah, me too. I don't know what I'm going to... I needed the money. I don't know what I'm going to do now.
Yeah, it really is something you should have checked out by your doctor. Like you said, it might not be anything, but it could be something serious.
I did one of these studies last month. They checked. They did the whole thing. I was fine. How can I do a heart condition in 30 days?
Well, it is
What does that
something you
mean?
should have checked out just in case. So I'm not a doctor. I can't tell
Well,
you
yeah, I know
exactly
that,
what
but
it
I mean,
means, but
I had
you
to
should
take
go
a
to
half
your
a day work to
physician
come
and
over
have
here.
it.
I don't have a doctor. I don't need a doctor. There's
Don't
nothing
have
wrong
a
with me.
regular care physician at all?
For what?
Primary?
I don't go to the doctor unless I'm sick. I've never been sick in the last 5 years.
So,
And I don't have insurance.
Philip, I know of a very decent clinic nearby, and they'll take into account your financial situation and charge accordingly. You might want to consider going there.
I can't afford anything. That's the point. That's why I try to do these studies to make the money.
Well, you can work that out with them. If you'd like, I can give you the address, I can give you the number. You can talk to them at least. You should have this checked out.
You know what? It's around here somewhere.
It's not far.
All right, do you have the address?
Absolutely.
I know that it wasn't my responsibility to do anything but see if the patient's vitals were normal, but I try to treat all potential test subjects like they're my patients. I know that some of them are in tough financial situations, and I don't think that should prevent them from being healthy.
You know, I've done a couple of these studies before, but this is the first one that wouldn't let me do it. At first, I was mad because I needed the money. But when that medical assistant, Gwen, told me about the clinic, I decided to check it out. It turns out the doc was right. It wasn't anything serious, but it's nice to know that there's people out there thinking about my well-being.
What do you think of Dr. Osher's communication style? How did Gwen demonstrate empathy? How did her actions go beyond what was expected of her? Modern healthcare continues to develop many innovations to help diagnose and cure disease. But the system has changed from the days when patients were treated by the same family doctor for many years. Today's patients may change physicians every time they change insurance plans. They may see specialists for life-threatening conditions. Your job is very important because you personalize healthcare encounters between patients and professionals they don't know, and help make patients feel like they are more than just an insurance claim number. Your attitude and actions can go a long way to increase a patient's understanding and comfort level. This, in turn, can have a positive influence on their well-being. As a healthcare worker, you will encounter people like the ones in this video, as well as many others. You will have many opportunities to make a positive difference in their lives by demonstrating respect and empathy.